My paper is on SOT recording system that I've been using for probably most of those 40 some years, and constantly trying to update it and make it more useful and more effective. But I want to start out by really asking three questions and actually answering them myself. First question is a thorough recording system really needed or necessary? And I don't think there's any doubt about that. There's certainly no doubt in my mind that the answer to that is yes. A thorough recording system is absolutely necessary. Is it beneficial? It's been really beneficial to me. Actually beneficial above and beyond what I expected when I started it. And is SOT really a type of work or a method of chiropractic, which I like to refer to it as? Is it really require a thorough recording system? And I don't think there's any doubt that it does. And I want to review the reasons why I think SOT requires a thorough recording system and why I think it's beneficial. And that's what we're going to do in this paper. Okay, number one, SOT recording system. SOT, and the reason that I like it so much is it's a systems method of chiropractic. All three, it's based on categories. All three categories are functional systems. Category 1, you're checking heel tension to see what the atlas is doing. Category 2, you're making cranial sutural changes to affect the sacroiliac joint. Category 3, you're dealing with a step out, toe out maneuver that is diagnostic of the lumbar spine. The body's an intimate system. All parts are in relationship. I personally think that the marketing ploy of SOT should be just promoting it as a system because all things are based on systems now. I think yesterday we had 5 papers presented at the end of this research conference. 2 were by Dr. Hancock and Dr. Chambers, were about adjusting one end of the cranial to treat the sacroiliac, and okay, I'm in the wrong spot already. And the body's a system. Let's leave it at that. Okay, system method of chiropractic. It's very assessment oriented. Indicators, you're always assessing what is going on, at what level they are, and it's an ongoing process. You're doing it at every visit. Confirming the category, what needs there are in the category to make the adjustment. Is it reasoning based? Absolutely. You're making judgments and conclusions every time you see the patient as to what is needed. And complexities of patient care. Again, years ago, being involved with analyzing a patient and addressing a patient's needs were much more simpler than I think they are today. Today you have involvement, what's relative to in their diet, what are they doing exercise-wise, what is their occupation, what is their activities, what medicines are they taking. There's just so much. What's their attitudes towards themselves and their particular health problems. So while chiropractic and SOT are spinal oriented or spinal based, to me it's just as much person based. So the complexities of caring and helping a person just necessary. So I just want to show you before we proceed, just to give you the landmarks of this little piece of paper here or cardboard, and this is the recording system that we use. Okay, starting in the upper left-hand corner, X-ray diagnosis, the diagnosis, ortho findings, and dental findings. We go down, we have a little bit of a key that says left, right, bilateral, negative, and a list of all the medications that they might be taking. Another, talking about the complexities, we used to have 1 or 2 medications in the early days. Now it's what, 39% of the population of over 65 takes at least 5 medications. So what involvement does that, what is the meaning of that towards what we're trying to accomplish in helping a person? We write the medications. We also write other facts in here. Here's ADL, what their activities of daily living and their concerns, dental referrals that are made, postural exercises, lumbar instructions, cervical instructions, date. These are all the basic SOT indicators and adjustments that we make, all listed, and we can follow them sequentially as we date it from visit to visit to visit. Okay? And all of these are, in the article that's published in the proceedings, there's an explanation of each of these. And we actually use that as the key that we send if we have any need to send our records anywhere. And it seems to have worked and still does. So each visit is the new baseline, and you go from visit to visit to visit. We're going to talk a little more about that, but that's the card. The back of the card is just, could be any piece of paper with lines in it. We call it the history of the day. We just write down, and we'll talk a little more about that as we go along, what they might be commenting on, or their concerns of the day, or any instructions that we might give them. We can look at this and see basically what we are doing, what we've done, how it compares, what direction it's going. I think we get a whole lot of information. My favorite part of the day is at lunchtime when I sit down after the morning hours and I go over these. And it's not unusual. Here's a card I brought along that's a completion of a patient. You'll see that most of the boxes, or a lot of the boxes, are filled in. A lot of the commentary along the framework of the card, his history comments, and the comments of our instructions. This gentleman, I wasn't doing real well with him, and we changed it from a category 3 to a category 2. When we got to category 2, we did much better with what we were trying to achieve, but we made these couple of comments in the margins here, which we can refer to very specific things on the back. But by looking at this, we get a quick reference to what we've done historically with this patient and what we're doing. We use the frame, we use the indicators, we go sequentially, and we have a baseline at each visit. SOT categories, talking about SOT and all the indicators and all the complexities of doing SOT. SOT is based on categories. Each category is a functional system. So you have to define which functional system is most in need of adjustment. What is the state of dysfunction? What are the indicators of dysfunction? They have to be recorded. The methods of adjusting have to be recorded. I'd like to look at categories using these three as inclusive of what a category is. If you understand what the functional system is, you can understand how the indicators indicated what state of dysfunction it is. These are some of the references I used in the things we're going to talk about as we go along. Dr. DeJarnett and his 2 manuals here, which I think are his 2 best manuals, 80 and 84. Hannah Line, which was a co-author, he's a co-author of Dr. Coopersting's paper yesterday, Evidence-Based Chiropractic Practice, which I think is a really good book. I'd like to, maybe along the way, we'll hear what Charles has to say with it, because it's basically a book about doing research. Senge was a book that I read in the 80s that really made me think about what I was doing a lot, because it's all based on what they call learning organization. Do what you're doing, and learning is a big part of what this adjusting card means to me, because it helps me learn SOT, it helps me learn what I'm doing and how I'm addressing that particular person's needs. Okay, Hooper, in his chiropractic approach to head pain, which is, I think the author of that book is Curl, right? And I think that's an excellent, excellent book on chiropractic. Hooper's chiropractic approach to head pain. So these are, I think these four have really been helpful references for me. Desjardins, keep absolute records of each adjustment and make it specific as to what you do. Desjardins was two things, if nothing else. He was a great, great observer of what was going on when he did something, and he kept really great records of what was happening. Hanaline in clinical practice documentation essentially consists of recording the subjective complaints, which we do in the back here, of the patient, the objective findings, one's assessment, and the plan for case management. Keep in mind, the plan for case management. Okay, and each patient, each office visit, we got to define the category. It's not that the category changes all the time, but sometimes it does. So you have to do some checks on it. I feel like I've gotten to the point where I actually, but when I get them off the plumb line, I have a really good feeling of whether I've addressed, we're maintaining the category or we have to make a change. Most of the time it's maintaining it. We have to note any kind of improvement or not improvement. We have to come up with a treatment plan. That's a biggie. Do we have them coming in enough? Do we have them coming in too much? Home care. Home care is important. It's just as important as the adjustment. If they're not supporting what you're doing, you could be spinning your wheels. And what adjustments we do. Each visit. Desjardins. This is my number one saying that I've dug out of the many books I've read of Desjardins. SOT is a thinking and reasoning procedure. Learn to observe and interpret signs into meaningful information. Reasoning meaning drawing conclusions, making judgments, even inferences as to what you're seeing, and making judgments and using that meaningful information to make, obviously, proper adjustment and to give proper advice. SENG, this got a learning organization systematically learns from its experience and what works and what doesn't work. The goal of learning is increased innovation, effectiveness, and performance. This is a learning tool. This has really been a learning tool for me. By sitting down and looking what we've done, how the patient's doing, how it compares from visit to visit, I find out what works, what's not working, what we have to do, what needs to be done to create a successful outcome. Hanaline, good clinical documentation should be a reflection of the thought process involved in patient management and provide evidence of patient's progress while under care. Thought process. I think this is a provoker of thought, provoker of thinking. Okay, so Hooper says treatment should be tailored to the individual needs of the patient and should be continually monitored and modified. Continually. So you're assessing their needs, developing a plan, evaluating the plan, and implementing the plan, and then you're going back up again. As you're implementing the plan, you need to assess how the plan is doing. So you're developing the plan, evaluating the plan, and going around at each visit. 1 minute. Okay. History of the day, basically, on the back of the card is patient's concerns, patient's comments, actions taken, information exchanged, decisions made, goals and plans. And that's what we try to keep it at 1 or 2 lines. But now this is what the card looks like. You're standing, seated, prone, supine. There you see the framework of it. We have a copy of the, like I said, of a key of all the meanings of all those things above are in the proceedings. Down below, we know what we've advised them, meds, dates, and that's what it looks like. Yesterday, I asked Dr. Cooperstein, I thought he gave a really great answer. What is his interpretation for a good or for a successful outcome? And he said not only that the patient feels better, but he emphasized that they're functionally better. And this is my interpretation of what a successful outcome is. Achieved when function has been maximized and the patient's needs are being properly managed. Senj, to understand the most challenging managerial issues required seeing the whole system that generates the issues. That's what we try to do by using this frame to keep all these notes. What are they doing? What have we advised them about? What meds are they taking? What activities can't they do? Almost done. Appropriate care will be much, I'll get a credit towards my next, okay, good. Appropriate care will be much more likely to ensue when clinical progress is carefully monitored and recorded, carefully. And I think success of what you're doing with each patient is certainly tied to what you do documenting it. Okay, conclusion. I think a system, whatever system you use, has to be accurate and objective, certainly meet ethical and legal needs, or requirements, I should say. Professional, chiropractic. We do, in our office, we only do Medicare forms. We don't do insurance. Everything is cash basis in our office. So we don't deal too much with meeting the demands of insurance companies, but we've had our records called for and we've sent them, and we've never had any kind of problems sending this, as long as we send along the key with it so they know what these things might mean, if they really do care what they mean. It's clinical and comprehensive. Here's the big one at the bottom that I really like about it. It's made me think, and it's helped me learn the work, learn how to be a good decision maker. It's also taught me how to be a better communicator. So I think to answer those questions we brought up in the beginning, I think whatever recording system you want to use is fine. I'm not saying this is the only one in the world, but whatever system you get, find one that really, is comprehensive and meets all these qualities, but also that you can reflect and see how you're doing in terms of your work with each of your patients. Thank you. We got one more. Thank you.